We'll now move on to oral questions put by members to ministers. The honourable member for Pictou West.
Thank you very much, Mr. Speaker. My question is for the Premier. Back in 2011, as Leader of the Opposition, the Premier tabled Bill number 88. That bill was titled An Act to Establish a Code of Ethics for Members of the House of Assembly. It envisioned a standard of conduct that all elected representatives would follow. It aimed to, Mr. Speaker, and I quote, ensure that members maintain the highest in public service ethics and preserve the integrity and dignity of the House of Assembly. Does the Premier have any intention to reintroduce this bill?
The Honourable Premier.
Mr. Speaker, I believe, first of all, thank the Honourable Member for her question. Yesterday and a number of times I've heard members of this House talk about the bill that's actually been introduced, new harassment policy, Mr. Speaker, that falls under your direction, Mr. Speaker. I think reflects the very issue that I was referring to in the bill the Honourable Member has tabled.
The Honourable Member for Pictou West.
Thank you, Mr. Speaker. I know very well, and just as recently as the other day, went over the terms of the harassment policy and was actually very proud to participate in developing it. One of the activities the policy prohibits is behavior that could reasonably demean, belittle, distress, or humiliate another member. Just yesterday, the Minister of Education admitted that his behavior, and I quote, and I will table, can be confrontational. So I'd like to know what action is the Premier going to take to ensure his minister no longer acts in a way that demeans, belittles another member of this House of Assembly.
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the question. Mr. Speaker, the Minister spoke openly to media, to all members of the House about his actions, Mr. Speaker. Reflect to that. I want to go back. Part of that conversation was related to me, Mr. Speaker, that was informed that someone told me there was a physical contact. At no time has anyone told that to me, Mr. Speaker. And I want to assure the honourable member that I continue not only to the Minister of Education but all members of our caucus, and I would indeed say to all members of this House, tone matters.
The honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. I'd like to ask the Premier three questions this morning about Medicare. First, about medication. Canada is, as we know, the only country with universal health care not to have a national pharmacare program. And this week, the federal NDP has introduced a universal pharmacare plan which will save families, even those that have benefits, $500 a year, and save companies $600 a year. And so I want to address a simple question to the Premier. Does he support a universal pharmacare program for the people of Nova Scotia?
The Honourable Premier.
Mr. Speaker, indeed, all Canadian premiers have supported a national pharmacare program. I fully expect it to become part of the federal election. I know the current federal government has announced in their budget a catastrophic drug coverage, which we all know constituents and members of our own communities who, through no fault of their own, if they're ill, get caught sometimes with an exuberant bill that is just impossible for them to pay. This legislation will deal with that. At the same time, ensuring that we as a country, Mr. Speaker, enjoy the buying power that we can, and ensuring that we make sure that all Canadians have access to medication.
The Honourable Leader of the New Democratic Party.
A second Medicare question, Mr. Speaker. This one about dentistry in the mouth and teeth. We know that our private for-profit dentistry system puts a real burden on public health care because people often go to their doctor for tooth-related pain. According to a recent study in Ontario, the cost of taxpayers there is $38 million a year on this front. And if dental care were covered under MSI in Nova Scotia, we wouldn't have as many people in our province as we do today whose health, whose confidence and whose lives are seriously undermined by tooth problems that they do not have the income, the money to have seen to. So I want to ask the Premier another simple question. Does he support extending MSI to cover dental care for the people of our province?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. Mr. Speaker, we've continued to support to ensuring that low-income families, Mr. Speaker, that no child should be disadvantaged from socioeconomic circumstances they are born into, whether it comes to pre-primary or the very issue that the Honourable Member is referring to when it comes to dental care. We'll continue to work with our partners to ensure, Mr. Speaker, that every Nova Scotian can have access to the appropriate dental care.
The Honourable Leader of the Official Opposition on his final supplementary.
And thirdly, Mr. Speaker, I would like to ask about mental health. No one can truthfully say that we don't have a two-tiered mental health care system in Nova Scotia, because we do. If you've got money or benefits, you can be seen on a one-on-one basis this week, maybe even today, at one of the private mental health services which are popping up all over Nova Scotia. But if you haven't got benefits or other insurance or the financial means, you face long waits, and there's no guarantee that there'll even be a one-on-one counselling relationship for you. So I want to ask the Premier, does he recognize that we have a two-tier mental health care system in Nova Scotia, one for people who have the means to pay and another one for those who don't?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank him for raising these very important issues, Mr. Speaker, that are facing Nova Scotia families today. The issue around mental health has been one, Mr. Speaker, that we as a government take very seriously. We continue to make investments in clinicians, but also, Mr. Speaker, continue to make investments in the wraparound services we're providing in our education system now, enhancing School Plus programs. One of the things that our expert panel, led by Dr. Stan Kuchar and Star Dobson, recommended to us that whatever decisions that we make, Mr. Speaker, needs to be evidence-based. But the Honourable Member raises the issue of timely access. We know there's more work to do. That's why we continue to make investments to ensure that we hire those clinicians, and at the same time looking at early identification of mental health issues, because we know our greatest success of ensuring and putting that individual back onto good health is by making sure that we do detect it early.
The Honourable Member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. My question is to the Premier. In his Code of Ethics Act, the Premier believed that a member should be publicly reprimanded if they behaved in a manner that was undeserving of this House. He went so far as to say the member should be suspended for a certain amount of time. Now he can't even be bothered to look into this type of behaviour and dismissed this harassing behaviour as exuberance. Does the Premier believe his Code of Ethics is something that sounds good until you're the one that has to implement it, or would he now be willing to re-examine this issue in the light of new allegations, evidence that supports the assertions of the member from Pictou East?
The Honourable Premier.
Thank you, Mr. Speaker. Again, I want to thank the Honourable Member for the question. She would know, Mr. Speaker, there is a policy in place that falls under you, Mr. Speaker. She would also know, Mr. Speaker, that the issues she's referring to were addressed to you. I was CC'd on them. She would also know, as I've said many times, and this issue was brought to my attention on Monday night, I continue to look through my records, Mr. Speaker, to ensure if there had been any correspondence between the two individuals who have raised the issue, who are now ex-members of this House, or their leaders at the time, Mr. Speaker. I found none, not only in the Premier's office, but not in my constituency office. And again, Mr. Speaker, I've said each time I've had an opportunity to stand up, at no time did anyone bring to my attention a physical altercation.
The Honourable Member for Cole Harbour Eastern Passage.
With all due respect, Mr. Speaker, the minister was indicating he was willing to have this issue go to an investigation, but the Premier and his government used their majority to vote that opportunity down. Mr. Speaker, the Premier's bill had also called for the creation of an Office of an Ethics and Conflict of Interest Commissioner. This commissioner would be empowered to investigate ethical complaints and recommend reprimands. The Commissioner's reports would be public, and the recommendations ruled upon by the House of Assembly, not the Premier, not the Executive Council, and not the Cabinet. If this sounds familiar, it's because the Premier used to say the same things about the Privacy Commissioner. My question to the Premier is, what changed between 2011 and 2019 that made this Premier abandon his high-minded plans for ethics and accountability for his government?
The Honourable Premier.
Thank you, Mr. Speaker. Again, I want to thank the Honourable Member for the question. Mr. Speaker, as I said a few minutes ago, Mr. Speaker, there is a policy in place now, Mr. Speaker, that was actually brought in under our government, Mr. Speaker, in cooperation with both opposition parties. We continue that policy will continue to be administered by you, Mr. Speaker, not by the Premier. Contrary to the comments made by the Honourable Member, it is under your jurisdiction, Mr. Speaker, and I, Mr. Speaker, am very proud of my record of how I conduct myself, not only on this side of the House, but when I had the privilege to sit on that side of the House, Mr. Speaker. And I will continue to work with my colleagues to make sure that everyone understands that tone matters and that it is important that as we express ourselves in this House, we do so in a way that is respectful.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. My question today is for the Minister of Labour and Advanced Education. Tuition fees in Nova Scotia are the fastest rising in the country, at an average of $8,500 last year, almost $2,000 higher than the national average. This year's budget does nothing to address the crisis of rising tuition fees. So while the student loan forgiveness program will help some students once they graduate, it fails to cover students who are the most vulnerable, who often don't finish their degrees within the time period. So, Mr. Speaker, why hasn't the minister insisted on more support for the most vulnerable post-secondary students in our province?
The Honourable Minister of Labour and Advanced Education.
Thank you, Mr. Speaker. And our budget does address the most vulnerable students in Nova Scotia. What we've done since we've been elected, we made Nova Scotia student loans interest-free. Mr. Speaker, then we turned around, we increased the bursary amount of any Nova Scotia student loan to 40%. Then what we did is we turned around and we made Nova Scotia loans forgivable above the federal threshold. This year's budget goes a step further and makes a Nova Scotia student loan up to 5 years fully forgivable upon graduation. So, Mr. Speaker, the most vulnerable people in our society not only receive the $1,283 bursary when they enter university, they receive $6,800, which is 40% forgivable on the day they receive it, and 100% forgivable on the day they graduate. Thank you, Mr. Speaker.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. Well, that's all well and good, but for an additional $3 million investment, this government could actually convert all student loans to upfront needs-based grants. This is what students are asking for. This could have a tremendous impact on post-secondary attainment for our province, while reducing the burden of debt for students who cannot complete 5 straight years of full-time study due to certain circumstances. So, Mr. Speaker, given that the #1 barrier students actually face to attaining post-secondary education is funding their tuition at the beginning of their degree, does the minister really believe that he's on the right track here?
The Honourable Minister of Labour.
Mr. Speaker, I believe we are 100% on the right track, because what we have seen in the data is that we actually have more students completing their degrees. I am very fortunate to have 5 universities in my riding. When I was elected, I was not the minister of this portfolio, but I met with all the institutions. And one of the challenges that one of the presidents told me they have is that students come to university and after a year or two they leave. It's a challenge not only for the institution, but the student, although they do gain a lot of useful experience, they don't finish their degrees, so they don't have that marketing ability of actually being able to put it on their resume and be more marketable in the job market. Mr. Speaker, one thing that students do tell me over and over again, their biggest issue is actually having job employment. They don't go to university to save $1,000, $2,000. They go because they want to start out in a career making $40,000, $50,000, $60,000 a year. That is the biggest issue, and that's what this government is working on.
The Honourable Member for Dartmouth. The Honourable Leader of the Official Opposition.
Thank you. Thank you. Thank you, Mr. Speaker. I've said many times that one of the highlights of this budget is the increased investment in mental health. But we have to get it right. And the last time the provincial government studied suicide was way back between 1995 and 2004. We've lost a lot of lives since then, Mr. Speaker. It wasn't until 2017 and a recommendation from Dr. Stan Kuchar that another study was commissioned. But, Mr. Speaker, the sad reality is the system is failing too many Nova Scotians today. And I'm pleased that there's a study ongoing, but I wonder if the Premier can inform the House as to how quickly Nova Scotians can expect to see improvements in the mental health system that the people of Nova Scotia so desperately need.
The Honourable Premier.
Thank you, Mr. Speaker. I appreciate the Honourable Member raising the question, particularly around the panel that was Dr. Stan Kuchar and Sarah Dobson were part of, working out across our province dealing with healthcare providers. A number of those recommendations are being implemented now. One of the things they were very clear about, Mr. Speaker, that it needs to be evidence-based. We need to be ensuring that the decisions we make are based with evidence from clinicians. That's why we have them make the recommendations. Part of it was also in this current budget, the investments that we're continuing to make in Schools Plus and the wraparound service providing the schools. This commission and all experts really will tell you the work that we do up front and early identification is critical. It is important. It's the best way to get our individual Nova Scotians back to good mental health. But the Honourable Member raised a question in and around those who are suffering today, and that work is ongoing.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. This week I received a note from a young gentleman who said he lost 2 friends to suicide and another one attempted suicide. That's just in the last 2 weeks. And unfortunately, members of this House will know that those types of notes aren't uncommon at all. Last weekend I spoke to a father who lost a 27-year-old son to suicide. And these are heartbreaking stories for all of us. And I certainly respect the work that Stark Cunningham and the team at the Mental Health Foundation are doing. And also community leaders like Sherry Blinkhorn in Pictou County. People are stepping up to do what they can, and they need to be supported by government. They need to be supported by investments. We need a strategic framework that makes sure we're going forward in the right direction. It's time to listen and learn to Nova Scotians. And I just wonder if the Premier can be just a little more clear on his hope for when we can start to see improvements, and what's the status of developing an actual strategic framework that can take us forward and help some of these Nova Scotians.
The Honourable Premier.
Mr. Speaker, I think, Mr. Speaker, we're seeing improvements in the system today, Mr. Speaker. That does not mean, though, that there are not families, individuals who are still suffering. That's why we're very pleased when we negotiated with the national government a new healthcare formula. We dedicated funding directly towards mental health. This budget has $11.7 million dedicated to it. We know there's continued to work around hiring clinicians, but I want to go back to what I said earlier. It is important that as we continue to support those families who are currently dealing with this issue and those Nova Scotians, that we do not lose sight of the fact that we need to continue to build the foundation of early identification. And early supports. It is very clear with all experts that will tell you, the sooner we identify mental health issues and provide treatment, the best outcomes are when we do that. That's why this budget reflects those investments, at the same time putting supports in and around trying to deal with and support families who are suffering today.
Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. And the investments are important for sure, but to be effective, they need to follow an actual plan. And I've said before that I believe that addictions and mental health are an issue that are serious enough, and the investment is significant enough that they warrant its own department with its own minister, somebody at the highest levels of government to be responsible and accountable. Because until we include the people who use the system, we will never really know the most effective way to solve the issues that they're facing. We must respect the advocacy groups and those Nova Scotians who have input into the system. So I just wonder if the Premier will confirm that the process that's ongoing includes an opportunity for public input and focus groups to really make sure that we understand the need so we can address it properly.
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the gentleman for the question. The issue that he has identified and is around having a separate issue or a department around addictions and mental health, Mr. Speaker, is actually going on today in British Columbia. It's an idea that I think warrants some consideration. At the same time, though, Mr. Speaker, I want to assure him that the issue of mental health and addictions continues to be a priority for the Department of Health. We continue to work with our partners, and of course, We continue to reach out and look to families and individuals who are experiencing these challenges or have experienced our system and in ways that we can improve it. And we will continue to do so. And I know even though Dr. Kuchar has been appointed to the Senate, his work around adolescent mental health will continue in our province.
The honourable member for Dartmouth East.
Mr. Speaker, my question is for the Minister of Justice. Over the last week, we've all become familiar with the case of Michelle Gray. Ms. Gray is a Nova Scotia woman who was caught in a roadside checkpoint and failed a cannabis sobriety test. Ms. Gray is a medical cannabis user, Mr. Speaker. She had her license suspended for 7 days and her car impounded. Mr. Speaker, it was later determined that she was not impaired, and the RCMP apologized for its error. My question to the minister is, does the minister know which test was applied in this case, and how did it give a false result? Thank you, Mr. Speaker.
The Honourable Minister of Justice.
Thank you, Mr. Speaker. In fact, it was not a matter of which tests that was given, Mr. Speaker. It was a document, an order of suspension that was submitted with an inappropriate element to that document completed, which indicated a need for a 7-day suspension, when in fact another element of the document, had it been indicated and captured, would have been a 24-hour suspension.
The honourable member for Dartmouth East.
Thank you, Mr. Speaker. Mr. Speaker, Corporal Lisa Croteau of the RCMP is quoted in support of Ms. Gray. She says there is no correlation between the level that you're at, the active THC in your body, and impairment. And I'll table that, Mr. Speaker. Now, Ms. Gray is considering her options to challenge a law that might be on shaky footing. Even the RCMP aren't sure how to properly apply it. Mr. Speaker, members on this side of the House have spoken multiple times on how Nova Scotia was not ready for legalized cannabis. My question is this: what does the minister believe is at the root of this mix-up? Is it a shaky law or is it insufficient training? Thank you, Mr. Speaker.
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and my colleague would know administrative sanctions around the privilege to have a driver's license exist right across the country, Mr. Speaker, both with alcohol and with the consumption of cannabis. I think it's important to recognize, Mr. Speaker, that whether you're a medicinal cannabis user or a recreational cannabis user, we discourage people from driving a motor vehicle. That's just good public safety. But to my colleague's question, Mr. Speaker, this is not a matter of public policy. We are confident in the policy and the administrative sanctions that form part of this legislation. This was an error in the completion of the order of suspension, nothing more, Mr. Speaker.
The honourable member for Cumberland South.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister of Education. Prior to the by-election last spring, Mr. Speaker, this government made an announcement that Spring Hill would finally receive a new elementary school. Thank you. I appreciate that. A new school has been high on the replacement list of the old former Schenectady Central Regional School Board. 2 elementary schools destined to be replaced are in states of disrepair. My question to the minister: when will the community of Spring Hill know where the new school will be located and what the design of that school may look like?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. I've seen both those schools. I know that community has been long waiting for a new facility. I'm very excited for the community that school is on our 5-year capital plan. We are in the process of finalizing fully our site selection process. That will allow us to do that more efficiently, and the community will be involved in that process, as will the municipality. And we will also ensure that on the design element of the school that the community is involved as well, because I know people have some great ideas in Spring Hill about what is needed in that new facility, and we want to make sure they're included.
Honourable member for Cumberland South.
Mr. Speaker, I thank the minister very much for that answer. The last correspondence I received from his office indicated that the selection process has changed. It also stated that the Department of Transportation and his department have done a municipal consult with the municipal entity. The minister proposed an opening date of 2021, which Spring Hill very much welcomes. Will the minister enlighten this House, and I'll table that letter, sorry. Will the minister enlighten this House of when Spring Hill will expect to be consulted and when the tender may go out for design and build?
The Honourable Minister of Education.
Mr. Speaker, I don't have a timeline right now, but I can tell the member that all the information I received from our officials, both from transportation and education, are indicating that we are on track with our 5-year plan, and we're working very hard to meet the timelines that we've laid out.
The Honourable Member for Halifax Needham.
Mr. Speaker, my question is for the Minister of Municipal Affairs. In his recent follow-up report, the Auditor General expressed concern that government departments have failed to complete some 30% of accepted recommendations after 2 years. Municipal Affairs is one of several departments singled out by the Auditor General for its poor completion rate. Mr. Speaker, why after 2 years has Municipal Affairs only completed 1 of 3 recommendations on identifying critical infrastructure in the province that is vulnerable in the event of a disaster?
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker, and thank the honourable member for the question. We continue to work with the Auditor General to keep him updated as to where we're at. There have been 3 of the 4. We're told 75% of the way through these recommendations. We continue to work with all of that critical infrastructure. It is important to the province, obviously, and to our municipal units as we move forward, and we'll continue to keep this House and the AG updated as we progress through. Thank you.
The Honourable Member for Halifax Needham.
Mr. Speaker, I found this finding of the Auditor General particularly worrisome given the nature of the recommendations. It is called critical infrastructure for a reason. The department's lack of follow-through is currently leaving communities in vulnerable situations in the event of a disaster. Mr. Speaker, will the minister table a complete list of the identified critical infrastructure in the province and its status?
The Honourable Minister of Municipal Affairs.
Thank you very much again, Mr. Speaker. We'll continue to work with the AG. As I said, this is of the utmost importance to us as well. We appreciate the recommendations that have come forward, and we'll continue to work with the AG, keep this House updated as I said a few moments ago, as we progress through these and as they're completed. So as far as tabling, Mr. Speaker, this is a public document, and we'll certainly table all the information as it becomes available to us and as these are completed, and happy to update the House at any time about this process. Thank you.
The Honourable Member for Kings North.
Thank you, Mr. Speaker. My question is for the Minister of TIR. Mr. Speaker, last spring there was quite a delay before the potholes in both Kings North and Kings South were filled. In fact, it was only really attended to by late July and August. And one issue was the need of 2 crews to fill potholes on the days the weather was good for work. My question for the minister is, given that there needs to be adequate staff to fill the potholes in a timely manner, will the minister confirm that 2 crews will be available for pothole filling this year, 1 crew for the north and 1 crew for the south?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker, and I thank the member for the question. One can be assured that potholes are non-discriminatory and they appear in all our ridings. And the member for King South has brought this forward significantly, and we're looking at how we can deploy our resources in both Kings North and Kings South to better address the problem. Thank you.
The Honourable Member for Kings North.
Thank you, Mr. Speaker, and I appreciate the answer on that and appreciate the support of the member from Kings South on that too. Mr. Speaker, a secondary issue is the quality of the asphalt. It simply does not seem to stand up like it used to. A testing program run out of Ontario has identified contaminants in the asphalt called recycled engine oil bottoms, or REOBs, and I will table two articles on that. The only way to know if these REOBs are present is to test the asphalt as it's being laid. Will the minister commit to testing our asphalt for REOBs to ensure that we are getting value for our paving dollar?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker. And I thank the member for the observations, and we'll certainly pass on the table documents to our technical people. But rest assured, we have a very rigorous testing process for our asphalt. It's continually monitored through the process, and we're always looking for better ways to spread our paving dollars and without affecting the integrity of the asphalt that we're using. So thank you very much.
The Honourable Member for Colchester, Musquodoboit Valley.
Thank you, Mr. Speaker. My question is for the Minister of Health and Wellness. A constituent of mine is a dialysis patient and has been for some time now. Recently, he's been told that he had to start paying for his own iron fragment shots and other medications which had always been covered with his treatment. My question is, why was the change made to the dialysis program, and is there alternative funding available for my constituent?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I'm not aware of a change having been made at the Health Authority for the delivery of those services, but happy to get the information from the member opposite to look into it further.
The Honourable Member for Colchester-Musqueam Valley.
Thank you, Minister, for that. This same patient is currently 13th on the waiting list for the Truro dialysis and has to travel an hour away to Halifax to receive his treatment. 3 years ago, there were 38 nurses serving approximately 200 patients in the Truro unit. Now there are approximately 350 patients for the same number of nurses. Is something being done to expand or free up space in dialysis units to ensure patients can access their treatments?
The Honourable Minister of Health.
Thank you, Mr. Speaker. In fact, yes, there is. We have embarked upon an expansion of dialysis stations or chairs throughout the province. I believe we are increasing seats by approximately 30%. We've made announcements in a number of communities. These projects are well underway. We look forward to having those additional seats. The communities where the additional chairs are being added for dialysis treatment were based upon a review that preceded my time in the office, but I'm assured that that review was largely focused on travel times for sites that did not currently have treatment, and some expansion at a few other sites.
The Honourable Member for Sackville-Beaverbank.
Yeah, thank you very much, Mr. Speaker. My question is for the Minister of Health as well. Mr. Speaker, in February, a longtime resident of Sackville was diagnosed with esophagus cancer. When he arrived for a specialist test at the VG, he was told that the only machine in the province that could properly examine him was broken. He was also told to return in 2 weeks because the specialist was going on vacation. Just prior to his arrival back at the VG, he was then told that there were no isotopes to conduct the scan, and there would not be any until further in the week. Obviously, his treatment cannot occur until after a scan, Mr. Speaker. Mr. Speaker, my question is the Minister aware of any isotope shortages at the VG or any other provincial medical facilities?
The Honourable Minister of Health.
Thank you, Mr. Speaker. That's something that I've recently had some inquiries about, so I've reached out to ask for the information through the Department and the Health Authority to determine if indeed there exists some challenges securing the volume of isotopes and the necessary isotopes to complete the testing in the province, and so I'm waiting to hear back.
The Honourable Member for Sackville-Beaverbank.
Yeah, thank you, Mr. Speaker. Mr. Speaker, there's now, my understanding is that there's now a backlog of people ahead of this gentleman who have to wait up to 10 days now. And of course, whenever there's a Nova Scotian who's diagnosed with something like cancer, you know, there's a lot of uncertainty. We want to get treatment as soon as possible. In these cases, I'm sure we can all appreciate that time is of the essence. Mr. Speaker, can the Minister please explain the Department's policy of communicating isotope shortages in the event that they do occur?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. Indeed, we share the concerns raised by the member and the importance of ensuring we have the appropriate equipment, technology to support our healthcare professionals to complete the testing necessary and treatment necessary for Nova Scotians, especially those with conditions such as cancer. And that's why, Mr. Speaker, in both the QE2 redevelopment here in Halifax and the Cape Breton redevelopment in the Cape Breton Regional Municipality, we've committed to building new cancer centres, Mr. Speaker. And in the Yarmouth area, we've committed to fulfill some recommendations that have been made by the community and the Cancer Care Nova Scotia to enhance services for people in that part of the province as well.
The Honourable Member for Queens Shelburne.
Thank you, Mr. Speaker. My question is to the Minister of Health. The crisis response team is a vital piece of mental health services in this province. Someone experiencing a mental health crisis often only has minutes to get the help they need. However, with the Crisis Response Services Coordinator and nurse jobs in the South Shore not being filled, I think that it's safe to say that help isn't always available in minutes. My question for the Minister of Health is, what action is he taking to ensure these crucial positions are filled as soon as possible?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Indeed, crisis response is one of the areas that is important to advance and make improvements on. That's why through the crisis line there have been in recent times expansion, additional staff hired to support the line. I believe in estimates, we talked about this last night, and I believe calls are answered within about on average a minute time period, and Mr. Speaker, they make every effort to do that. As far as recruitment, those efforts are ongoing, and of course in our healthcare system, including mental health clinicians, making every effort in all parts of the province to ensure those positions are filled.
The Honourable Member for Queens Shelburne.
Thank you, Mr. Speaker. Crisis services are not available around the clock in the South Shore. Physicians are being faced with patients in crisis at the ER, and they are not able to access the support they need because the crisis response line is only available Monday to Fridays, and then only until 3:30 p.m. A mental health crisis does not happen on a schedule, Mr. Speaker, so the services shouldn't be available on one. Can the minister explain what his plan is to provide more thorough mental health services for the residents of the South Shore?
The Honourable Minister of Health.
Thank you, Mr. Speaker. One of the investments made this year in our budget and is the support of our expansion of the adolescent outreach mental health model of supports, Mr. Speaker, that we've previously referred to as the expansion of the CAPER-based model. Clinically, it's treated as an adolescent outreach. That expansion, Mr. Speaker, goes to provide supports within the western zone of the province, as well as the northern zone, areas that needed additional supports. And we see those supports in communities approximately 41 delivered through approximately 41 schools throughout the province of the northern and western zone. So that's one example of our investment to strengthen mental health supports in her community.
The Honourable Member for Dartmouth North.
Mr. Speaker, my question is for the Minister of Environment. The Dartmouth Lakes are a social and economic backbone of our community. In February, a group of concerned citizens gathered at the Finley Community Centre with myself and my colleague from Dartmouth South to discuss the worrying status of our lakes. Last summer, Lake Bannock, which plays host to 4 local paddling clubs and international paddling competitions, was closed for several weeks, more than any other summer, due mainly to algae growth. As our summers get warmer, the residents of Dartmouth are worried that this will become a recurring problem. Can the minister tell me what the department is doing to ensure that invasive algae and weed growth is dealt with in Dartmouth's lakes?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. This was a subject, I thank the member for that question again, certainly something that was raised in estimates again yesterday. The main concern with the Department of Environment in our lakes, and we recognize certainly, we know, I believe there's almost 2,400 lakes in our province, and we know with the climate change expanding, we know the temperatures are getting warmer, that algae may be a problem in many of the lakes around our provinces. Unfortunately, the problem is complex. We need to know where the food supplying that algae is coming from, and there can be numerous sources, but the main focus of the Department of Environment, Mr. Speaker, is to make sure that the lakes are safe to use. We need to know that there's no bacteria in the water that's going to affect people, and that's why our staff does testing to make sure that the bacteria levels are suffice for swimmers, and if it's not, then the lakes are closed for swimming purposes. Thank you, Mr. Speaker.
The Honourable Member for Dartmouth North.
Mr. Speaker, water protection falls under provincial jurisdiction. In Little Albro Lake, where the invasive lily floating yellow heart has made the lake unusable, residents who have called the minister's department have been redirected to the city. From there, they're redirected back to the province. They've taken it upon themselves to try and stem the growth of this invasive species, but they are quickly running out of options. Now there are reports that the floating yellow heart has been spotted in neighbouring Big Albro Lake. Mr. Speaker, if the minister insists on continuing to evade the responsibility of the province to protect our waterways, will she at least commit to providing funding to the HRM necessary to battle this invasive plant and make our lakes usable again?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker, and I thank the honourable member for that question. Again, you know, the mandate of the Department of Environment is for the safety of the the lack of bacteria in the lakes, and certainly we are responding to that in the best way possible. As for the invasive species, that falls under the direction of the Department of Lands and Forestry. I know there was also conversation yesterday about weeds in the lakes, and if we'll look after the weeds in the lakes. This is a joint responsibility, Mr. Speaker. This doesn't fall under the Department of Environment. Certainly the HRM is also responsible for lakes in their areas. Lands and Forestry also has some responsibility, as well as the Department of Environment. We all take our role very seriously. We realize the importance of lakes to our province. After all, if you're flying above the province, all you see is lakes, and you realize the abundance of them. Thank you, Mr. Speaker.
The Honourable Member for Victoria the Lakes.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister of Transportation and Infrastructure Renewal. Mr. Speaker, on Saturday past, I had the opportunity to travel the road that is part of the Cabot Trail through Middle River. Last year, construction started on a section of the road, but it was never completed. The same is true for a section of the Cabot Trail, but in the Ingonish area. So my question is, can the Minister explain any other reason why work that had begun on these roads, but because it was too late in the season, couldn't be finished?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker. And we have a very ambitious program in the province. As I mentioned before, currently in the budget would be a $300 million commitment to our capital program, and deploying that capital takes a lot of work. Rest assured that those two particular projects, instead of being done in the late year when it's not good to be laying asphalt, will be done as soon as the asphalt plants get open, and that might actually come in very handy for the section in the Middle River area.
The Honourable Member for Victoria the Lakes.
Thank you, Mr. Speaker. You know, it always seems that much of the work being done in the eastern part of the province is never completed during the same construction season. But also on my road tour, the section of the road from where the construction from last year stops to the Victoria-Inverness County line and beyond is deplorable, but it's not on the 5-year plan. The road is in such bad shape that patching will not solve the problem. So my question to the Minister is, when can the residents expect to see a tender called to complete this section of road?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker, and I thank the member opposite for the question. And I also appreciate his diligence in bringing this matter to me earlier in the week through a correspondence. We immediately put a very focused lens on that situation, and there is no doubt that the road is in bad shape. There's no doubt about it. The spring breakup in particular has affected it. And as recently as this morning, I've been talking to the district manager, the area manager, and we are formulating a plan to effect the repair. The last of the work from last year will bring a major construction company on site very shortly, as soon as the asphalt plant's open, and we're hoping to be able to use that opportunity to enhance that particular piece.
The Honourable Member for Pictou Centre.
My question is to the Minister responsible for WCB. Mr. Speaker, in our province, when an injured worker has been declined benefits through the WC process, they can appeal. Majority of members in this legislature are familiar with the process. Initial application, caseworker, hearing officer, WCAT, local offices. The process can literally take years. The injured worker in each level of appeal has 30 days to file the necessary appeal. However, WCB has no time limit on their decision making. My question to the Minister, does he feel it is reasonable to have such an incredibly different set of rules for the applicant and the respondent?
The Honourable Minister of Labour and Advanced Education.
Thank you, Mr. Speaker. I'd like to inform the member that In instances where an individual does take more than 30 days, WCB does not have that as a hard and fast rule, and they will make exceptions to that rule. Thank you, Mr. Speaker.
The honourable member for Pictou Centre.
Mr. Speaker, they certainly have been making an exception to the rule for Daryl McKinnon in Pictou County. He's been doing this for about 6, 7, 8 years, Mr. Speaker. Mr. Speaker, we presently have an injured worker whose name is familiar to all members of this House. Medical specialists, lawyers during the past several years have provided credible evidence and unwavering support for Mr. McKinnon's application. He has just, once again, appealed the decision and has been told that the Internal Appeals Division is so backed up, it is unlikely that his appeal will be heard this calendar year. He already has suffered through too many years of appeals. My question to the Minister, is the Minister aware of this backlog and the impact that each injured worker feels every day awaiting the decisions from WCB, and is he willing to assist this Nova Scotian?
The Honourable Minister of Labour.
Mr. Speaker, I have quarterly meetings with WCB. We've actually addressed this issue of a backlog. Mr. Speaker, what I can tell the honourable member is that what we have done is identified ways of speeding up the process, not for one Nova Scotian or one individual, but for all of them who are affected by this. And Mr. Speaker, WCB is working diligently at moving forward their cases as fast as they can. Thank you.
The honourable member for Cumberland North.
Thank you, Mr. Speaker. Automated external defibrillators, AEDs, save lives. I'd like to ask the Minister of Education if he would be willing to help me remove the red tape and bureaucracy that's preventing AEDs from being installed in both schools in Pugwash.
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. These decisions currently remain in local hands of the principal administration of schools, but I'm happy to discuss the issue with the member, particularly where she depicted this as a process preventing this from happening. You know, that is a local decision. I'm not sure what the local reasoning is for that, but happy to discuss it with the member.
The honourable member for Cumberland North.
Thank you, Mr. Speaker. The community health boards in our community a couple of years ago raised enough money to have AEDs both placed in the Cyrus Eaton Elementary as well as the Pugwash District High School. And the school board at the time blocked it due to policy that they wanted to put in place. Most recently, I had local citizens provide enough money to have AEDs purchased, and again was told that because of a policy that is not supported, or a policy that the school board or previous school board wanted to use, can't be used. So it's red tape that's preventing AEDs being installed that could save lives. So I'm wondering, I have sent correspondence to the Minister's office, and if he'd be willing to help me to remove that red tape. Thank you.
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. I'm not aware of a policy that would prevent this from happening, but I can definitely take a look to see if that's the case. The way I understand it is school can make the decision to have one of these, but then that requires individuals to be trained, and sometimes they're not willing to take that step. But I'm happy to look at the situation. I do think this is an important issue. We've even seen in this House on occasion when we've had health scares that that these things can save lives. So very happy to have a follow-up with the member on this.
The Honourable Member for Cape Breton Richmond.
Mr. Speaker, earlier this week, the County of Richmond dramatically fired its Chief Administrative Officer in a vote that caught the community off guard. The Warden is displeased and has openly questioned the future of the governance of Richmond Council, and it has called into question a number of decisions and behaviours. But, Mr. Speaker, it's important to deal with the facts and not fiction. It's important to have clarity and not supposition. Is the Minister of Municipal Affairs in any way concerned with the affairs or function of Richmond County Council, and can he please clarify if he feels his office needs to intervene or assist in any way?
The Honourable Minister of Municipal Affairs.
Thank you, Mr. Speaker. I thank the honourable member for the question. And just like her, and I'm sure all members in this House, we all represent areas where we have councils. I'm concerned about all councils in the province of Nova Scotia, and I want to assure the honourable member that we're always there when we're needed and when we're asked to come in and to assist in any way we can, and we certainly have in a variety of municipalities across the province, and we'll continue to do that, Mr. Speaker. Thank you.
The honourable member for Cape Breton Richmond.
Thank Thank you, Mr. Speaker. As I know that the minister can appreciate, because we all have our own constituencies, I'm receiving a number of inquiries concerned about this issue from my constituents, and I would like the honourable member, and thank you for his response just earlier, to just help to basically reassure the constituents in my area that his department is obviously on top of things, but also perhaps you could confirm if all the financial reporting of the County of Richmond are up to date with the Department of Municipal Affairs. That would be great, Mr. Speaker.
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. And again, I thank the member for the question. We are certainly aware of this issue. I think the entire province is. If they read the media, there's been some stories out there. She mentioned in her first question, Mr. Speaker, the facts. That is exactly what I go by as minister and our staff go by to continue to work with. And as far as financial reporting, I will say that they are already doing the reporting that we had put into a new piece of regulation, Mr. Speaker, and they are doing a fine job of that, I might say, as well as others. They were early on this. Things have been coming out, and it just so happens to have, as a follow-up to our discussions yesterday about this issue the honourable member has been concerned about, I have some documentation that will actually show those financials for her, and these are public documents as well. They're available to you, but we'll have them ready for you at the end of QP. Thank you very much, Mr. Speaker.
Thank you very much. Time allotted for oral questions put by members to ministers has